Welcome to today's Explainer. We're diving straight into a seriously fascinating preventative treatment from our source material today. It's got roots stretching back hundreds of years, but the wild thing is, it's still heavily utilized in modern clinics right now. So let's explore the world of Tianjiu therapy together.
But before we get into the science and the history, I want you to think about your own health for a second. Are you already dreading the winter months? Maybe you're someone who deals with chronic winter ailments. You know the ones, the endless sneezing from allergic rhinitis, hands and feet that literally feel like ice blocks no matter how many wool socks you layer on, or maybe severe menstrual cramps that always seem to flare up when the temperature drops. It's incredibly frustrating, right? Well, the source material we are looking at today suggests the secret to a better winter actually starts right in the middle of summer.
Okay, let's dive into this. Here is our roadmap for today. 1. What is Tianjiu? 2. Winter disease, summer cure. 3. The clinical evidence. 4. 2026 treatment dates. And 5. Contraindications and care.
All right, Section 1. What is Tianjiu? Ancient roots, modern practice.
So, Tianjiu literally translates to heavenly moxibustion. It's a traditional Chinese external therapy that involves applying these warm herbal patches directly to specific acupoints on your body. Our sources trace this exact practice all the way back to the Qing dynasty, specifically to a medical text called Zhangxi Yitang. Basically, a practitioner grinds up warm-natured herbs. We're talking things like white mustard seed, asarum, and ginger. They turn it into a paste and apply it to the skin to stimulate the body's meridians. Those are the energetic pathways in traditional Chinese medicine. And the goal? To encourage blood flow and completely dispel the cold.
To give you an idea of how this looks today, here is an authentic clinical handout from a modern hospital's traditional medicine department. It lays out the therapy details, the dates, and the care instructions for patients. It's just a really great reminder that we aren't talking about some obscure historical footnote here. We are exploring an active, highly integrated part of preventative healthcare. Moving right along to Section 2, Winter Disease, Summer Cure. Now, this entire practice is built around one absolutely brilliant core tenet: treating winter diseases in summer, or dongbing shaji. I want you to imagine your body is basically a giant solar battery. During the hottest days of the year, the Earth's yang energy, its heat, is at its absolute maximum. Tianjiu therapy aims to capture that peak environmental heat and literally store it inside your body. It charges up your internal solar battery so you have maximum resistance when winter's extreme cold finally rolls around. And this brings us to the two distinct seasonal peaks of this therapy, Sanfu and Sanju. Sanfu happens during those absolute hottest summer days. Because the environmental heat is so intense, the pores on your skin naturally open way up. This makes them perfectly receptive to absorbing all that warm herbal medicine from the patches. Sanju, on the flip side, happens during the absolute coldest days of winter. Applying the patches during Sanju basically serves as a booster shot. It complements, extends, and locks in all those therapeutic benefits you absorbed over the summer.
Okay, Section 3, the clinical evidence. Let's look at the numbers. To see if this actually works outside of theory, our sources point us to a very specific, super detailed clinical trial conducted back in 2006 at the Changgung Memorial Hospital. Researchers took 45 patients who were suffering from allergic rhinitis. You know, that chronic, super annoying nasal allergy. They treated them strictly using Tianjiu patches during the Sanfu summer days, carefully placing the herbs on specific back and neck acupoints, like dajue and feishu.
And what's really interesting is they didn't just ask, hey, is your nose still runny? They used something called the Rhinoconjunctivitis Quality of Life Questionnaire, or RQLQ, which tracks the whole body. And the results? The trial showed statistically significant improvements across the board. Patients reported way better sleep quality, improved emotional well-being, meaning way less irritability and fatigue, and of course, major reductions in those physical nasal and eye symptoms.
But here is the massive long-term payoff. When researchers checked back in with these patients 5 months later, smack in the middle of the winter allergy season, 60% of them reported sustained long-term symptom relief. 60%! Just think about that for a second. A few hours of wearing herbal patches in July and August resulted in a measurably better winter for the majority of the people in the trial. It's a real game changer.
The trial also threw out some really surprising data points that kind of busted a few myths. First, younger patients, specifically those under 30, actually saw much faster initial results. Second, and this is a big one, historically people assumed that if the patch caused a massive, angry blister, it meant the medicine was working better. but the data proved the exact opposite. Patients with milder skin reactions actually experienced better short-term outcomes. And finally, factors like your gender or whether you had a history of asthma had absolutely zero negative impact on the overall long-term efficacy.
Right, moving to Section 4, 2026 treatment dates. Because this therapy is strictly tied to the traditional lunar and solar calendars, the dates shift around every single year. So for 2026, if you want to get that maximum solar battery charge we talked about, you need to mark your calendar for the Sanfu summer dates. The initial Fu is on July 15th, middle Fu is July 25th, final Fu is August 14th, and then an enhancement patch is applied on August 24th. Our sources emphasize that completing this full sequence is absolutely vital to properly building up your body's internal heat.
Then, to lock in that summer treatment, the 2026 to 2027 Tianjiu winter dates act as your essential booster. That sequence kicks off right around the winter solstice on December 21st, follows up on December 30th, jumps over to January 9th, 2027, and wraps up the whole shebang with an enhancement on January 18th.
And our final section, Section 5, Contraindications and Care.
So if you were to actually walk into a clinic on one of those specific dates, here's exactly what your patient journey would look like. First up, a practitioner will diagnose your specific constitution, just to ensure you're a good fit for it. Second, they apply that herbal paste to specific acupoints on your back, neck, or abdomen. Third, you wait. Adults generally wear the patch for anywhere from 1 to 4 hours, while kids might only wear it for like 30 minutes to an hour. Finally, you take it off at home and start the post-care routine.
But before you go booking an appointment, you really need to consider if you fall into any of these categories, because safety always comes first. Our sources are super clear on who should strictly avoid Tianjiu. Pregnant women shouldn't use it since those potent warming herbs can disrupt their changing physiology. Infants under 2 years old are totally excluded because their skin is just way too delicate. If you currently have a fever, a cold, or an active infection, you've got to wait until you are completely healthy. And naturally, if you have severe skin conditions or you know you're allergic to adhesives, this therapy is definitely not for you.
Now, for those who do get the treatment, proper post-care is everything. You should fully expect some physical sensations like redness, maybe a slight burning or itching. Don't panic, that's just the medicine doing its job. But you absolutely must keep the area dry for a few hours, so no immediate swimming or showering. Most importantly, you have to help that warm medicine work by avoiding dietary triggers. That means a strict avoidance of iced drinks, raw foods, spicy dishes, and seafood on the day of your treatment. So yeah, put down the spicy tuna roll. You definitely don't want to cool your body down right after going out of your way to warm it up.
And there you have it. We've covered the history, the seasonal philosophy, the hard clinical data, and the practical steps of Tianjiu therapy. It's such a remarkable example of ancient wisdom completely holding up to modern scrutiny. So I'll leave you with this final thought. If the secret to surviving winter is actually hiding in the blazing heat of summer, what other natural rhythms are we totally ignoring in our daily health routines? Thank you so much for joining me on this explainer, and keep staying curious.